Hello everyone, my name is Dr. Vivek Mahajan. I am a consultant in joint replacement and sports medicine, and I've been in practice since 15 years, and I'm doing joint replacements and seeing patients for sports injuries since 15 years. I work in India, in New Delhi, in Indian Spinal Injuries Center. It's a specialized hospital for orthopedics, and it is one of the most advanced center for orthopedics and rehabilitation in Asia. It's an exclusively orthopedics and spine care hospital, and I usually do joint replacements using the most latest technique using the computer navigation. It is a painless surgery where your hospital stay, we try to make it as much painless as possible using the most latest techniques in pain management. When we use the computer navigation, it increases the precision for the surgery and the life of the artificial joint which we use, it increases. Normally, a typical joint replacement life is somewhere around 15-20 years. But when we use computer navigation, the life of joint replacement increases to somewhere around 25 to 30 years. So the technology helps in prolonging the life of artificial joint. We try our best that when we are doing the surgery, it should be the last surgery. You should not be needing another surgery or a revision once we do the joint replacement. Now there are few things I want to share with you regarding joint replacement. One, that when we do the joint replacement, patient thinks that we take out the complete joint and put the new joint. No, that's not true. What actually we do, the area which is damaged, we just put an artificial cap in that area on top as well as on bottom. So basically this is more like a resurfacing. And the life of this joint, which is usually 15-20 years, with the help of computer navigation or using the latest techniques, the life increases to around, as I said, 25-30 years. Now, usually there is no bed rest after the joint replacement. You start walking within 24 hours because we use the most advanced techniques of pain management. So when you are pain free after the surgery, you get up and walk early. And usually you are discharged in a typical 4 to 5 days once you start stairs climbing. So basically once you are independent, then you go home. Now, sometimes we do the total joint replacements, but there are few patients who don't need the total joint replacements, in whom only part of the joint is damaged. In those patients, we do the partial joint replacements, which is also called as a unicondylar joint replacement. By doing a partial joint replacement, you are much more active. You can squat, you can sit, you can do mild jogging, and the recovery is much faster and quicker than the total joint replacement. Now we get a lot of international patients from all over the world, from Australia, from Africa. A lot of these patients, they have a concern regarding their follow-up. So I want to share with you that in our hospital there is a facility for telemedicine. So once we have done the surgery, you need not come back to India again and again. So you can get in touch with me over the teleconferencing, where we can interact, we can talk, we can see each other, and you can share with us regarding your progress.